All right. Good morning, good afternoon, good evening to everyone who is watching this video. I'm Devesh Lari from the Next Genius Foundation. And in this video, we have Jill Meyer from Ithaca College. Jill Meyer is the Clinical Assistant Professor of Physical Therapy at Ithaca College. And in this video, we're going to learn about physical therapy or physiotherapy. If I'm not wrong, we can call it with both the names, right?
Correct.
Okay. So here you're going to learn about the structure, the academic structure across 4 years or 6 years, I think, right? That's what the program will be. It's a 6-year program, not a 4-year program. We learn about the concentrations within physical therapy. We learn about what kind of students or what kind of skills you should develop as a student if you plan to study physical therapy at college. We learn about what to do upon graduation. And finally, Jill will share with us about future trends. So without any further ado, Jill, welcome. It's a pleasure to have you with us here today. And I'm looking forward to learning more about physical therapy.
Great. Well, thank you for that great introduction, Devish. Yes, my name is Jill Meyer. I am a physical therapist, so I have a doctor of physical therapy, and I'm also a board certified neurologic clinical specialist. So that means I specialize in treating patients with neurologic diagnoses, such as spinal cord injury, traumatic brain injury, brain or spinal cord tumor, stroke. So you may have heard of some of those diagnoses: Parkinson's disease, multiple sclerosis, ALS is another one, GBS. So those are sort of those types of patients that I work with. And then I also teach in that course content at Ithaca College too. So I'm going to take you through a little bit about the doctoral program of physical therapy in the United States. It is a doctoral program in order to practice. That means anywhere from a 6 to 7 year degree. And so I'll show you a little bit about the two of those. I clearly understand Ithaca College's course curriculum a little bit better than other schools, but I'll be able to give you an idea of whether you go in at an entry-level degree, which will be a 6-year program, versus going in after you get a bachelor's degree, which then that would be more like a 7-year program. So a 4-year bachelor degree plus the 3-year graduate degree for PT. Like I said, Ithaca College is where I work. So, it's a little bit of an introduction here, but also beyond that. So there is a lot of areas in terms of the academic overview. Physical therapy encompasses movement and understanding the body's movement and how we move and how all of our systems interact. And so it's a very hands-on career. So as part of the coursework, you do a lot of hands-on activities. So you're either working with classmates who are healthy individuals practicing skills, or you're working under the guidance of clinicians working with actual patients. So in the 6-year entry-level program, it's considered, we call it a 3+3. So your first 3 years are tackling those general education requirements, biochemistry, physics, and then you end up, after those first 3 years, you move into actually taking graduate courses within the senior year. So you try to get everything else done in those first 3 years, which is possible. And then you move into the 3 professional phase. We call it the professional phase of the program. And then that's three years of all graduate level coursework. At the end of the senior year, either way, no matter where you go, if you're going into an entry-level 6-year program, you will get a bachelor's degree. So we have had students only finish up to the bachelor's portion, decide they want to go into something else. And so they still left with a bachelor's degree at 4 years, and then were able to apply to other programs for various degrees that they were looking for. A 7-year program is then getting that bachelor's degree, and then you have to apply into a physical therapy graduate school, which is typically a 3-year program. So if you know right when you finish your secondary schooling that you want to become a physical therapist or physiotherapist, in the United States, it's called physical therapy, but in majority of countries, it's called physiotherapy. It's synonymous. Then it's really great if you were to enter right into a physical therapy program, if you know that's what you want to do, because then it's 6 years of school versus 7. So for this one, like I said, another component of the first 3 years is to complete a minor. So that's in any area of study: psychology, Spanish. I mean, we even have a minor of dance. So you can choose your minor communications or health, sports psychology, all sorts of different things. At the end of the 3 years, there is a human anatomy dissection, and this should be a component of all physical therapy programs. where you actually do hands-on dissection of cadavers. So you would, if you're looking into a PT program, this is something you'll want to ask about. Each program is a little bit unique in that some programs will offer the opportunity of you doing all of the dissecting, versus others will have what we call prosected cadavers, and you kind of just go in and look and learn. So if dissecting is something that interests you, I find it amazing. I've been able to work in the anatomy lab for many years as a lab instructor as well. And I think it's an amazing component, and it's one of the most incredible ways to learn is to be able to dissect. So specifically, our lab we have about 15 donors, and the students they do a 10-week very intensive human anatomy course that they dissect the donors inside and out. So it's really learning how all those systems work together, the arterial supply, the nervous system, all the musculoskeletal, the organs. It's really cool. So then after that summer, you officially were to, and this is how a lot of programs do tend to work, you enter the professional phase of the program. And then that is where you complete your graduate level coursework, and then also your clinical experiences, which I'll talk about in a few minutes. If you were to enter into a graduate entry program, you would receive your bachelor's degree first. You're going to then apply to PT school. A lot of the prerequisites will be biochem, physics, and anatomy that you would need to have completed during that bachelor's degree in order to enter into a graduate program. You might need more depending on the program. So for example, one of the graduate programs in Delaware requires a statistics and a psychology prerequisite. So in your bachelor's degree, you would need to show proof that you had taken and successfully passed those courses. You also need to take what we call the GREs, or the graduate, I actually forget the acronym, but you need to take the GREs to get into physical therapy school. What I found in majority of programs is that in order to get in, the minimum GPA of the undergraduate needs to be at 3.5. Many programs will also require observation hours. So 50 hours with a licensed physiotherapist observing them in order to apply to the physical therapy program. And then once you get in, you would do your 3 full-time years of graduate coursework, and that also would include your clinical internships. Some of these are pictures too of some of our students they're doing neuroanatomy in the top photo, and this is one of our students working with an athlete. So once you graduate from an accredited program, you actually earn the title of Doctor of Physical Therapy. So you are a doctor of your field. It's an autonomous practice. You don't work under anybody but yourself. It's licensed. And then you take the national licensing exam, and you can take that national licensing exam with any state and then work within that state. It's only one exam once, and then the same exam applies nationally. You just need to register with each different state, but you could swap states. You just have to get a registration within it. And then you're a licensed PT, and you can work, in the United States. I'd say overall, they're physical therapists or physios are very much in demand right now. The starting salary, what I'm seeing United States wise, is around in the about $70,000 range for entry level at the moment. Just so you've got an idea of what that looks like. Okay. Yeah. Any questions?
I do have one question.
Yeah.
And so, international students getting into a medicine program in the US is extremely difficult, right? There's very few seats now. Are there limitations like this for a physical therapy program as well, a doctoral or a master's program in physical therapy as well?
Is it challenging? Actually, I think it's much more. I actually think it's more accessible than the medical field. I actually have a good friend from India who came here and did his degree without a problem. He now has a PhD, and his primary goal is research. So he's really kind of moved up. But that was something that he really didn't have an issue getting in. So a lot of it is. One, I'll talk a little bit about some of the things that we look for in our students, but as long as you're meeting some of the basic science requirements and have showed success in those courses, there's lots of opportunities in the United States to get into the physiotherapy programs. And then whether you take that degree, to another country, or you stay in the United States and practice, that's really up to you. But no, it is not as competitive as the medical schooling. It is not.
Perfect. Thanks for sharing that. All right,
Yeah.
So we can move on then.
Great. I will just talk about part of the academic program is clinical experiences, which is probably the biggest component. And so at Ithaca College, these are integrated and then also external. So a lot of physical therapy schools in the United States will have an on-campus clinic, and students will be required to work in the on-campus clinic. So here we have a clinic that does orthopedics, neurologic PT, and pediatric PT. We have an aquatic environment. We also have which I think I'm blocking the view there, but we also have a Center for Life Skills program, which works with patients after stroke or brain injury. It's very interdisciplinary. So you also work with professionals in the speech language pathology departments, occupational therapy. So you may have heard of those degrees as well. And then we do a geriatrics, and we have a partnership with our local medical center. And so starting, in the spring, I actually take students to the medical center, and we treat patients in the ICU, acute care, the inpatient rehab units, and surgical units. So it's really great. This is one of our clinicians at the local hospital. And then again, these are many of our students working in our on-campus clinics. So then in every physical therapy program, you'll also need to do full-time off-campus clinics. So for us, this is anywhere in the country. And we have over 1,000 sites affiliated with different areas of the country. And so you would do an 8-week, a 10-week, a 12-week clinical internship. This is full-time. So you're looking at 40 to 50 hours a week in the clinic, working with patients under the supervision of a licensed therapist. So that kind of gives you an idea of the clinical experiences.
So my next question to you is, Jill, can you tell us about what are the concentrations within the physical therapy major or the program? Yeah.
Yeah, great. So the clinical concentrations, first off, the programs will train you to be a generalist, meaning that you could, when you graduate, you should be able to take the boards, the exam, the big licensing exam, and cover all aspects of physical therapy, from pediatrics to geriatrics, from the ICU to the sports clinic. So it will train you to be a generalist, but you also, during your time in college, will have opportunities to specialize in various areas that you think might interest you in the future. So know that you do need to be a generalist in order to pass that exam, but then that opens up doors for you anywhere. You could work in a hospital, or you could work in, with a Major League Baseball team. So your doors could really be open there. But there are opportunities to specialize in areas such as orthopedics, sports rehabilitation. That's a lot of times, I think, where individuals, that's what they know best when they hear the word physiotherapy. They think about orthopedics and sports, but there's also neurology. There's pediatrics, there's geriatrics, there's a hospital setting, acute care. So yeah, a lot of things.
Fantastic. So Jill, my next question to you is, what are certain skills a student must start developing, or what are certain activities that they can start doing if they are considering a physical therapy program?
Great. Yeah. Could this be a field for you? I think the biggest thing here is if you enjoy health and science, that's a big one. If you've taken some anatomy courses, you enjoy the body, kind of learning about how the systems work and how the body moves, definitely something to think about. If you enjoy working with others and working with people and communicating, a lot of this field is communicating. So, you would want to be able to like doing that and enjoy talking with other people and learning about them, and then being able to improve their quality of life. So I find that it's an extremely rewarding profession. And you are on your feet for a good portion of the day. So if you think about yourself, you enjoy being behind a desk or sitting a lot, this is probably more, you're probably more about 70% of the day is up, moving around, interacting with people. And then you're doing paperwork, for about probably more like 30% of your day. So yeah, that's kind of a little bit about it. And then I can talk about sort of success in the major too.
Yes. Before moving on to that, Jill, working with people and sort of maybe sports people and things like that, it can be stressful, because you're dealing with a lot of maybe sports injuries, or you're dealing with the challenges. So how do you manage stress as a part of your day-to-day life?
That's a great question. Yeah. So, as in any field, there is a sense of burnout that can occur for anybody, especially as we balance other things beyond just work, right? So you will have, your academics, and then there's personal things that happen in all of our lives. So balancing all of that. But I do find that physical therapy is a pretty straightforward, like, 8 to 5 kind of job. Depending on which field you decide to work in, you may be required to work weekends if you're working through a hospital, but then you have days off during the week. There also, as working in the United States, there are, you usually get anywhere between 2 to 4 weeks off of vacation a year. So you make sure that you use that time to help yourself kind of recharge and get to do other things that you really enjoy. The longer you're in the field, the more time off you also accrue. So that also helps. So when you're starting off, you're working more hours a little bit, but then, you get better with that. And normally you're working, if you put yourself in an environment that creates some mentorship, we always remind our students and try to encourage them to seek an environment when they graduate that they're not alone, or they're not with just one other person, that they're with a lot of other people who have experience, and they can provide the mentorship and support that you need as you're learning. So that when you get that new case and you can't figure out what's wrong with the person, or they're not responding how you want to, or, I work with patients with spinal cord injury on ventilators, or so if there's an emergency response and that ventilator isn't working, that, they're not breathing, that I have a quick team that I can get emergency attention and care. So surrounding yourself by friends, really, and coworkers and peers is going to be a real ticket to kind of helping you find that balance and support in the actual clinical environment.
Fantastic. That's a great response. Thank you for answering that. Moving on, what are some jobs or some graduate programs that you see your students doing upon graduation?
Yeah, I'll just mention right before we get into, I just wanted you to know too that when we're looking for acceptance into PT schools, having taken biology and chemistry in a secondary school, or we call it high school here, is a requirement to get into a physical therapy program, even at the entry level. Physics, it should not say physical, it should say physics, but physics is also recommended. We do recommend also students being involved in some extracurricular activities. If you have opportunities to work at different, health clinics, or you're just involved in a team or a sports team, that does help too. And I will say that in our program, the students that are accepted into our program tend to be in the top 15 to 20% of their graduating classes for American schools. So for terms of career options, honestly, it's endless. Anywhere that people need healthcare is really where physical therapists are hired and can be working. So that could be a hospital, a rehab center, an outpatient facility, a school. Children will need, care in schools, long-term care facilities, sports facilities. Yeah, it's an autonomous practice. You'll get referrals from physicians, but we also have an opportunity in the United States. All the states also have what we call direct access. So a patient could just walk into your clinic and say, hey, I need care, without a physician referral. And so sometimes we see that and we get that. And that's kind of fun too, because you're not sure necessarily what's going on yet, and you have to put a lot of pieces together for the puzzle. But as you can imagine, if anybody has had a family member in a hospital setting, you're getting weak and they need help and monitoring when they start to get up and move around again. COVID, the pandemic, has clearly created a need for physical therapists even more to get that aerobic capacity back up and their strength and get them back on their feet. So.
That's fantastic.
I'll show you. Sorry, I will follow up. Sorry, there's one other slide just to show you some other things.
Yes, absolutely.
So those were some of the general specialty areas, but I will tell you, PT, it's just keeps expanding. So we have these are some of our grads, but there's specialty areas in pelvic health. So it used to be called just women's health, but men have pelvises too. So it becomes, it used to be, so it's pelvic health in general, so working with males after prostate cancer, or working with a female during pregnancy or after birth. There's oncology rehabilitation. So there's really specific needs that chemo and radiation surgeries cause that they're working with. We have physical therapists in the military. We have physical therapists that work in the aquatic environment. We have physical therapists working in, post-COVID care right now. Physical therapists who do specifically into spinal cord injury rehabilitation. So working on being able to get somebody back into doing the things they love, like fishing or biking, those kind of things, concussion rehab and sports. So just know that it is all over the place for PT. Anywhere you think about health can really, cardiopulmonary, all of those areas, those people will need care after.
Superb. I didn't know that there's so many different fields within physiotherapy. When my knowledge was actually pretty limited, but now I know so much. I used to think that okay, physiotherapy means sports related injuries or
Yeah.
things like that, and I believe a lot of students might come in with that idea or notion in their mind, but it's so much more than that. So many, in fact, a lot of all big organizations would have something related to physical therapy, physiotherapy. A lot of times corporations have a small physiotherapy department because they know that when people sit for long hours, they need some sort of ways to keep them active, or they might get into some challenges which are related to sitting for long hours, right? Yeah.
Absolutely. And the ergonomics, right? And carpal
Yeah.
tunnel and all sorts of neck issues and back issues. And we have a lot of manual specialties too, and spine fellowships. So you can really go into any of these in the United States too. Many of these practices have what we call certified. You can become a certified specialist in the area, which requires you to do an additional 2,000 hours of care in that area, direct hands-on contact, and then sit for a board exam. And so that's really actually well recognized too, and will often different facilities are seeking out specialists in the given areas because they're trained beyond just the basics. So yeah, it's a really large field. It's very well respected in the United States, and in some countries I hear it's different. It just, there's a different understanding and a different approach in different places. But here it's gone big. So.
That's superb. Fantastic. We're almost coming towards the end of the call. But before closing, Jill, we would like to know about where do you see physiotherapy, physical therapy going in the next few years? What are the future trends that you see?
Yeah, great. So one, I think the biggest thing is we will always be in need. So we are all aging, right? We're an aging population. So whether you want to get into geriatrics or not, regardless, as we start to age, we tend to have more health problems and more concerns. So there is going to always be a need for us. There's a big sports population in orthopedic, and there's a lot of research opportunities out there right now too that physical therapists are involved in. So whether that's post-stroke care, where I worked at a large hospital and there was a research component. So some of my patients would be recruited for different research opportunities, and we would be able to work with them on maybe they were trialing a drug, right? And one group got the medication and did physical therapy, and then the other group just got the medication. So you're looking at kind of the effects of the drug. So we see that a lot with chemo. Chemo is more effective if you're doing physical therapy in combination, meaning we have higher cure rates in those patients and less mortality or improved survival. So now we're seeing a lot of post-COVID. There's COVID brings on other issues that come about respiratory wise, and then also increases occurrences of other big things that have been happening. And more recently, one of the areas that I am super excited about, because I work a lot with brain and spinal cord injury, is combining PT with technology. So if you've heard of any of this stuff, we have things like brain-computer interface, where they're actually going and putting electrodes into the brain, and then people are able to control their environment through their brain. So, now an arm that didn't work before, I have this electrode where the arm is in the brain, and then I can actually, move the arm. So it's pretty neat. This is all new stuff. It's definitely more trialed. Epidural stimulators are now being implanted in patients after spinal cord injury. So we're seeing they are doing intensive physical therapy following an implantation, and that we're seeing them, having an opportunity to potentially walk again. So this is kind of some of the things that I think are really changing. We're using virtual reality a lot now, combining it with physical therapy. So I think we're going to see all of this. And I tell our students all the time, like, you got to know what this kind of stuff is, because none of this can happen alone. They'd have to have physical therapy after or in combination to be effective. So that's sort of where I see everything going.
Superb, really. I mean, there's so much, there's at the intersection of computer science and real medicine. Physiotherapy has so much role to play. We talk about artificial arms or artificial limbs, or how they work.
Yes.
I'm not sure if we call them artificial or bionic arms, or what those things, of course, I think there's so much that physiotherapy is being used to do all of that. So thank you so much, Jill. It was a pleasure to have this conversation with you, and it's such an enlightening conversation. I really enjoyed it. And before closing, any final word of advice for the students who will be watching this video?
Good luck, good luck with whatever you decide and wherever your career paths take you, but you're going to do great. Okay. So have some faith in yourself, have confidence in your abilities, and you'll find your passion, find what you love. I love going to work every day. So I really hope that whatever that is for you, that you can find that too.
Super. Thank you so much.